Hello, my name is Rachel Aponze, and I'm a registered nurse with the North Simcoe Muskoka Hospice Palliative Care Network. I have been asked to speak with you today about a palliative approach to care in long-term care and how that is a more person-centered experience for both the resident and for their persons of importance. So thank you for joining me. I'd first like to start off by saying, what is a palliative approach to care? So this is a way in which we provide care. It's an approach that aims to provide comfort and improve the quality of life through whole person-centered care. A palliative approach is different than just palliative care because it's a way of doing things, a way of providing care, a way of speaking, a way of focusing on the priorities of the resident. A palliative approach to care means that we are focused on comfort, dignity, and quality of life for your person of importance rather than trying to cure the illness. A palliative approach to care is designed to support your person of importance in all possible ways, physically, emotionally, and spiritually, even before they are nearing end of life. And that's why it's called an approach. A palliative approach to care involves careful management of physical and emotional symptoms to help ensure that your person of importance feels safe, supported, and well cared for. The entire staff of the long-term care home will support you and your person of importance through this time, helping with communication, decision-making, and emotional support. Our goal as health service providers is to honor the wishes of your person of importance, to keep them as comfortable and as peaceful as possible, and to make sure this time is as meaningful and supportive as it can be for everyone involved. A palliative approach to care is different than end-of-life care. A palliative approach to care prioritizes comfort, dignity, and meaningful living by addressing physical, emotional, social, and spiritual needs, and this can be provided within a long-term care home. This leads to a more person-centered experience, particularly for the person of importance who may not have a cure for their illness. Instead of the focus of care becomes living well for the time that's left. Staff trained in a palliative approach to care are more skilled in identifying and managing symptoms such as pain, breathlessness, nausea, anxiety, or depression, often before they become severe or require hospitalization, to manage them. And the staff in long-term care have these skills. Palliative approach to care encourages early advanced palliative care conversations and ongoing conversations as the goals of care change. This ensures that care aligns with the values, the preferences, and the wishes of the person of importance. By providing comfort, focused care, and managing symptoms in long-term care homes, the need for emergency room visits or hospital admissions is often reduced. This minimizes disruptions and minimizes stress for the person of importance and for the individual's person of importance that lives outside the long-term care home. People of importance are supported through difficult decisions and emotional challenges during the illness journey and at end of life within long-term care. Bereavement and grief support are also part of the approach, which strengthens trust in the care team and reduces caregiver burden. Palliative approach to care fosters collaboration among all care team members, including nurses, physicians, personal support workers, health service workers, spiritual care providers, social workers, chaplains. This ensures a holistic, coordinated care plan. Palliative approach to care normalizes death as part of life It promotes respectful and compassionate end-of-life care that honors the life story of the person of importance. I'd like you to take a moment here and pause on this slide. It has an awful lot of information, but what it really does is distinguish the difference between a palliative approach to care and end of life. End of life care is the final days to weeks in a person's life journey, but a palliative approach to care begins way before that. A lot of people understand that palliative care is end of life care only, but I'd like to distinguish that a palliative approach to care can start at the time of the diagnosis of a life-limiting illness. And we know that COPD, CHF, dementia, renal disease, heart disease, and frailty in and of itself are life-limiting illnesses. They are diseases that begin a certain way and have an illness trajectory that gradually deteriorates and the person becomes more and more frail. That's why we call it a palliative approach, because a focus on quality of life and great symptom management is provided at the beginning when a diagnosis is first given or that diagnosis starts to impair that person's function. End of life is just the tail end of that palliative approach to care, that final days to weeks. So you can see here that in this chart, the differences between a palliative approach to care as far as timing and end of life care as far as timing. And on the left, you can see the support services that are available at each stage, who it's for, the goals of care, and how they may change. So just to take a moment and pause here and have a read. The spectrum of care, you may or may not have seen that, simply provides a visual of what I've just described. So at the time of diagnosis of a life-limiting illness, some of which I've mentioned, a palliative approach to care can be provided. And its approach, a way of having conversations, a way of managing symptoms, a way of providing that care. And palliative care can partner with therapies to modify disease. That can happen within a long-term care facility. But as that disease gets a little bit worse and worse and worse, and that person becomes more and more frail, you can see that the therapies to modify the disease and control the disease are a little more limited, but the therapies to relieve suffering are increased and are prioritized as very important to improve quality of life for the duration that that person has. Dying is work. Just as birth is work for a mother and a baby, dying also requires work for your person of importance and for you as the family bearing witness to this transition. Your healthcare team will walk alongside you on this journey. A palliative approach to care helps to ensure a person-centered care focus throughout the illness trajectory. It helps promote early care planning and advanced care planning discussions. It promotes better quality of life for the person and their people of importance. It allows a proactive, not a reactive approach to symptom management. And it gives the person of importance and their people of importance more time for legacy work, closure, reflection, and preparation for the work of end of life. How do we know when your person of importance is transitioning into end of life? These illness trajectories may look familiar to you when you think about your person of importance and their health over the last few years. We can see that those that are struggling with organ system failure, like heart disease, kidney disease, liver disease, their trajectories have ebbs and flows. So points in which they're stable for a period of time and then they have an acute episode. then they go back to baseline and hold steady for a period of time, and another dip down with an acute instance, stabilizing again and another dip. You can see, however, though, their baseline never is as high as it was to begin with. So there is a gradual deterioration after each acute episode. I'm going to skip over to dementia and frailty, which are very, very common and maybe what your person of importance is experiencing on top of possibly some other ones. Dementia also has a gradual deterioration from the time of diagnosis, a deterioration in their function, their physical abilities, then a deterioration in their mindset, and leading to death in the end. This is very variable and can take upward to 4 to 8 years or even longer at times, which makes it very difficult to understand that dementia and frailty are also life-limiting illnesses. You may recognize this chart as well, or hear the staff talking about this tool. It's called a palliative performance scale. I won't explain it in depth, but just to say that this allows the staff in the home to communicate with one another, with the different disciplines within the home, about the current function of your person of importance. It allows them to understand the way they're able to move themselves or require assistance. It indicates if they're able to care for themselves or how much assistance they require. And it just allows them to recognize changes from one point in time to another. Typically, long-term care homes use this tool upon admission, and then every few weeks or every few months, they do it again. And you can gradually see differences in a person's functioning using this tool. It allows them to recognize and then to come to people of interest and initiate conversations around goals of care if they're seeing changes in their performance status. This is another tool that you may hear the staff members using within long-term care home. Frailty scale is a very, very common tool used in long-term care, and again, helps identify changes when they're taking place over periods of time. There are, from our perspective as health care providers, general indicators of decline that indicate to us there is a transition or there are changes taking place, triggering conversations, triggering changes in the care plan, triggering a family meeting. You can pause on this slide for a few minutes and have a little bit of a look at what some of those general indicators of decline are. I'll just highlight a few of them. There could be an increased need for support on an ongoing basis. There could be repeated unplanned trips to the emergency department or acute crises. Maybe some of these things took place prior to admission to the long-term care home. Those acute instances might have been the red flags that highlighted the need for more care, which allowed them to be admitted into long-term care. Those changes continue to take place even within the home. You may be seeing more unstable or complex symptoms or a deterioration in their level of wellness. You may see decreases in their activity or their functional performance, that PPS that we described. There may be increased weight loss in the last 6 months without a cause being identified. So what can we expect at end of life? What are common symptoms and changes that you may see? Once again, a very, very busy chart. Feel free to pause here and have a look. On the left, I've described the different symptoms that are very, very common at end of life. I've also described what it may look like and what does it mean. Because a lot of times as people of importance, we don't truly understand and we may be very nervous about the changes we're seeing when our person of importance is transitioning into end of life. This will help normalize what's happening and indicate to us that there definitely is a transition taking place, and this is the normal process of the body shutting down. I wanted to touch base a little bit on the role of food and fluids at end of life, because can be very alarming. This is often a very difficult process for persons of importance. Food and nutrition are essential for survival. Eating and gathering for meals is social, and feeding our friends and family is a way we show love and compassion. We've done this our entire lives. At the end of life, we can care for our loved ones in many ways, because the desire, the need, and interest for food and fluid diminishes, and this is a normal part of the dying process. Loss of appetite and a decrease in thirst are very, very common as the body begins to shut down. It doesn't need the nourishment that it did before. It doesn't have the interest in the nourishment. Dry mouth is very common. This can make eating less desirable and more difficult. So the staff in the long-term care home will provide frequent mouth care for comfort. And that's very important. The staff can teach you how to do mouth care so that you can assist in the care for your person of importance. And one thing I wanted to highlight is make sure that if your person of importance has lost their appetite and has a decreased in thirst, that they're not interested in foods and fluid, or they're very, very drowsy and not alert enough to take in food, please do not give foods or fluid if they're unable to swallow, because this could cause choking. It is very, very important to live well at any stage in someone's life and at any stage in someone's illness trajectory. We want to continue to be involved in activities which bring meaning to one's life, even as their abilities change. We want to begin or continue to be physically, mentally, and socially active. This is what living in long-term care homes is all about, continuing to maintain some of that independence for as long as we possibly can. We want to eat nutritious diet and get adequate sleep. We want to reduce or modify risk factors. Most likely, if they're in a long-term care home, smoking will be limited, alcohol consumption will be limited. We want to make sure that we're managing other health conditions such as diabetes and heart disease. And so those medications will be monitored and continue to be looked after by the staff in the long-term care home. And we want to complete a safety review of all medications. So your prescriber, in partnership with the pharmacist and the team in the long-term care home, will be reevaluating the medications on a regular basis to make sure that everything that's required is prescribed in the appropriate ways, and that the physical environment is free from the risk of safety hazards and falls and things like that. It is important to shift the meaning of hope from hoping for a cure to hoping for comfort, connection, purpose, and peace. Hope is sustained in realistic and meaningful ways throughout end of life. So a lot of times people feel when conversations take place about goals of care, or what would be important to you, what would be of value to you, what would you like to prioritize at this point in life, can dispel hope, can stomp hope. But in fact, studies have shown that hope is sustained in a meaningful way through end of life by having those conversations, by allowing people of interest and their peoples of importance to have meaningful conversations with the care team to ensure that what is a priority for them is what is provided. It is important to build a care plan based around what gives someone meaning in their life and what preserves their autonomy and their sense of self. This is done by supporting them to express their values, their preferences, and their goals. And within long-term care, the staff will meet regularly with you to speak about What is of value for your person of importance? It is important that respectful care continue as it emphasizes respect for the whole person, their spiritual self, their cultural self, their physical self, and their mental self. Each person will be seen as an individual with rich life stories. It is important to control pain, shortness of breath, anxiety, among other symptoms. This will allow your person of importance to engage in meaningful moments and maintain their sense of control and identity. The thorough and timely assessment and management of symptoms will help to minimize the risk of symptom crises and/or undesired transfers to the hospital. It is important that we foster a culture of compassion that helps you and your person of importance feel safe, heard, and valued, while maintaining both dignity and hope through the dying process. Have a conversation with your person of importance about their wishes. You want to know, is it their desire for body or organ donation? What is their belief and wishes for end of life? Are there special needs or requests? How do they want to be cared for at end of life? What is a priority for them? Where do they want to be cared for at end of life? What are their after-death wishes, their funeral arrangements, specific hymns, music, people to be involved in memorial donations? Where is the location of important documents, accounts, passwords, etc.? I can't stress enough the importance of communicating about these priorities and planning ahead, and essentially communicating these wishes with the care team. It's very, very important for the long-term care home staff to be aware of these important details. And ways that you can provide comfort to your person of importance. You want to keep them company. You want to talk with them, watch TV, read, or just sit with them. Listen to their concerns and fears about what they're experiencing. Be willing to reminisce about their life. Reassure them that their wishes are going to be honored. Ask if there is anything that you can do. Respect their wishes and their need for privacy, and be present. We hope that this has provided you with some valuable information. And remember, we are walking this journey with you and your person of importance. Please reach out to your healthcare team in the long-term care home for anything that you require. Thank you.